unfortunately she's not around, and she have a meeting, so I decided to eat somewhere while waiting for her because the secretary said I need to go back after lunch, which is 1 o'clock probably. Yeah. I'm doing a pap smear, which is very, very important to those women who are already experienced an intercourse. So, yeah, we'll check you later what's going on or how they do it. I'm not showing the whole detail, but since I'll just give you some ideas why women should do it, a pap smear, and it is advisable to do it yearly.
A few moments later.
So, nandito na kami, guys. I need to check for my ultrasound. Ay, dagan naman di ako. Good. We're here already at Sacred Heart, and I already do it. So the pap smear is done, and it's challenging because it's a different feeling, and yeah, I will talk to you the details later when I'm at home, so it's properly explained, and you need to drink a bottle of water. So I will ikan dito lang. Okay. Ay, lalaki. So, hi guys, as I promised, I'm going to share it with you, the details of my journey on doing the procedure of pap smear and transvaginal TVS. They call it TVS. It's like an ultrasound of your vagina, okay? And I'm doing this by two parts. First is I'm talking about the pap smear, and then second is the transvaginal. Okay. So in pap smear we have 4 questions. First is what, who, how, and when. Okay. How much? Okay. So first we're talking about is the pap smear. So what is pap smear? Pap smear is also called a pap test. It's a procedure to test for cervical cancer, mostly, or cervical cancer in women. So a pap smear involves collecting cells from your cervix. So I'm going to show you the picture later, or yeah, just beside me on how the procedure goes. Okay. So the lower narrow end of your uterus, that's that at the top of your vagina. That's what they're doing, the pap smear. So by doing this, they're detecting cervical cancer early with the pap smear. Gives you a greater chance at a cure. A pap smear can also detect changes in your cervical cells that suggest cancer may develop in the future. So detecting these abnormal cells early with the pap smear is your first step in halting the possible development of cervical cancer. So in my experience, it is my 2 times of doing the procedure, because it should be done every once a year, okay? And it is very important for us women to check our paps. To do pap smear every year. So second question is who are qualified for this procedure. Okay, so the qualified of this procedure is a married woman or in a relationship, or to those women or girls who are already experienced contact. Okay, because that's those are the people who are qualified for that procedure thing. So we're talking married woman in a relationship, girlfriend, boyfriend and girlfriend, and those women or girls who are experience intercourse or contact. You're asking if a virgin can do pap smear. I asked that concern to my OB-GYN, and she said, as long as you're really new to yourself, that you're really a virgin that never been touched, never been put something inside your, if you know what I mean, it's not, don't worry about pap smear. If you know that you're virgin, you never been touched and everything. Okay. And because mostly ir- um that's that's not applicable to you guys, those are virgin. And there's some concern that they've asked to me if does it hurt. Well, you've been into a contact and your hole is a little bit large. Okay, it might hurt a little bit, but just a little bit, guys. For the realities, it hurts, not, it doesn't hurt a lot. Okay, it just hurt for the tools that they put in, but then after a few minutes or an hour, it's just gone. It's just a feeling that you might feel, but again, it really doesn't hurt. Some people might discourage other people. That's what they think of, because I don't know what's the reason. Because for me, like, I have lots of friends been talking a lot of negative about PAPS tests or pap smear, but guys, don't listen to them because it doesn't help you. Okay, because for me, if some people ask me, I really tell them the truth that it might hurt. It hurts, but not a lot. It's just so quick, the pain, but then it's gone, you know. So just go on. Don't listen to other people say it's for your own sake. They keep saying it hurts, it hurts, it hurts. Come on, it's all in the mind. And if you keep thinking about that, it won't help other girls or women to do the pap smear. By doing that, keep saying that hurt might discourage them, and they don't want to go to the OB-GYN just to check their cervix, you know. So okay, let's jump to the third question: how much it costs. So here in CDO, here in Cagayan de Oro, Mindanao, northern Mindanao rather, um in my doctor I paid 600, and by giving that thing, that slab that they put into your cervix, just to then bring it to the laboratory, I paid 250, so overall I paid 850. It's worth it, guys. Okay, and just don't think about the cost, think of your health. Okay, so when is the result? As my experience, it will take 5 days, so I need to go back there for the result after 5 days. Okay, so yeah, that's it. And during the pap smear, the doctor will ask you, it should be happen in, or it should be done to the doctor's office, and the doctor and you or the secretary is around in that office, and the doctor will ask you to undress to undress completely, or only from the waist down. That should be done, and it's really normal. It might or you might feel shy or uncomfortable, but hey guys, it's a doctor's woman, or she is a doctor who've been seeing too many vaginas, so it's not a problem, yeah, right? So this is just a normal procedure. It might take few minutes, but that's it, just to get slab on your cervix, just to check if you don't have cervical cancer or you're safe. Okay, so yeah, you lie down on your back on an exam table with your knees bent. Your heels rest in support called stirrups. Your doctor will gently insert an instrument called a speculum into your vagina. The speculum holds the walls of your vagina apart so that the doctor can easily see your cervix. Inserting the speculum may cause a sensation of pressure in your cervix in your pelvic area. Then your doctor will take samples of your cervical cells using a soft brush and a flat scraping device called spatula. This usually doesn't hurt. You see? I mean, the next part that I will tackle about is about the transvaginal ultrasound. Okay? So, what is transvaginal ultrasound? So I'm going to read this for you guys. A transvaginal ultrasound or endovaginal ultrasound is a safe and straightforward procedure that doctors use to examine the internal organs in the female pelvic region. So what is transvaginal ultrasound for? So it can check for ovarian cysts, ovarian tumors, fibroids, and polyps. So, it is also necessary to use transvaginal ultrasound to examine the following organs: the vagina, the cervix, uterus, fallopian tubes, ovaries, urinary bladder. In my case, they've done my transvaginal ultrasound post. Wait, I'm going to check first. It's pre-void and post-void. So, pre-void means your urinary bladder is full. Okay. And then my post-void is they do ultrasound where it's empty. So, pre-void, full, post-void is empty. But mine is failure because you see, see it's covered, but anyways, it says my post void I still have 30 ml, but the doctor, my OB-GYN, talked about it, and she said that's okay because some patients have more than that if they do post void because they cannot be all of them. Okay, but in the ultrasound center, they required me to make my urinary bladder empty, but still I can't pee. Anyways, so also again, as what I've mentioned a while ago, by having a transvaginal ultrasound, you can see you will know if you have cysts, ovarian cysts, and if your fallopian tube are okay. Because also in my case, I am a polycystic ovary. Doctor said it is a genetic. I have normal size retroverted uterus with intact endometrium and normal ultrasound of both adnesia. I don't know how they say it. But anyways, I was just praying again that I will have a regular menstruation because if I don't have a regular menstruation, that can cause my polycystic ovary will. I don't want to do that, and according to my doctor, it's about your lifestyle, and that's still up to you. And I know there's a lot of women there also that has a polycystic ovaries. Okay. So, how to prepare for a transvaginal ultrasound? A transvaginal ultrasound is a simple and painless procedure that requires very little preparation. So, the doctor may request that your bladder may be empty or only partially full. Conversely, they may ask you to come with a full bladder, which has happened to me, which is the pre-void. That's pre-void, I think. Yeah, full bladder is a pre-void. If this is the cyst, they may advise you to drink 32 ounces of liquid over a 30-minute period, starting 60 minutes before the examination begins. Yeah, I drink a lot of water that time, at least the 1 liter bottled water. I drink that all. Okay, the probe is mildly uncomfortable. If you have any concern about the procedure and how it feels, talk to the doctor to learn more. If you have menstruation, and are wearing a tampon, you will need to remove it before the ultrasound. So that means even you have a period, you can still have an ultrasound. A doctor or a trained technician will perform most of the transvaginal ultrasounds. So mostly in that procedure, you don't worry, it's dark. Okay, you don't need to be shy type. And mostly same as like you're doing a pap smear. You lay down, lay down, and then lower your butt, and then bend your knees, and that's it. So yeah, I'm making this video, guys, to make everyone informed and aware that having a procedure, having a pap smear procedure, or a pap test, and having a transvaginal ultrasound are safe. The pap smear, it has a pain, that much pain. Don't be such overacting, because it's not. This, just think about it, that it's for your own good, not for anybody else who will say or who will discourage you. Just go on. Pap smear, it might hurt, but it will just gone like an hour. And then the transvaginal is a painless procedure, so you don't need to worry. Again, it's for your own good. So I hope this video will help you realize, or will help you now to motivate to do the pap smear, to clean or to check your cervix, that you are clear of cervical cancer. I hope this is helping you guys. I hope this will help you do the same like what I've done. And yeah, I hope you will like this video. And so if you haven't subscribed, so please subscribe, and see you in my next vlog. Thank you, guys.